Dr. Madhulika Yogi, and today I'm going to talk about black fungus, which is scientifically known as mucormycosis. What is this black fungus? It is a kind of fungus that is present everywhere in our environment. It is omnipresent. It is present in the air that we are breathing. It is present in the plants in our homes, in the pets that are walking around us, in the birds that are coming in and out, everywhere. Important to note that it is also present in the oxygen humidifier machine pipes and in the ventilator systems in the hospitals. Now what happens here is a normal human immunity is very well capable to tackle this kind of a fungal infection easily. It is only when the immunity lowers down, like in patients with diabetes, obesity, chronic kidney diseases, repeated blood transfusions, those who have undergone a surgery, an organ transplant. These are the kind of patients that especially need to watch out for symptoms of black fungus. Now what happens in patients with COVID-19 is that the infection of COVID-19 begins as a flu when the virus enters the system and starts multiplying. And within the course of time, our body generates an immune response to tackle that virus, to fight off that virus. This response that our body generates to fight off this virus is usually so exaggerated and massive that it damages the lung tissues and the patient presents with breathlessness. They get their CT scan done and the CT scan shows changes in the lung CT. To control further damage by our immune system, we lower down the immunity by giving immunity suppressant drugs like steroids. Now steroids definitely help in lowering down the damage that is being produced by our body against COVID. But it also puts the body at risk to various other secondary infections. According to the University of Pittsburgh, the number of autopsied bodies presenting with secondary bacterial infection after COVID-19 was 37%. Another report conducted in meta-analysis by NHM stated that the simultaneous risk of infections in patients with COVID-19 was 3.5%, and after COVID-19, the number of patients who developed infections secondary were 14.2%. What does this tell us? This tells us that the immunity weakened in COVID-19 due to the treatment leaves us at the risk of other bacterial and other fungal infections. That is the reason why in the regimen of COVID-19 treatment, antibiotics have been added to prevent these bacterial infections. Now, why can't we just give out antifungals and prevent mucormycosis as well? Because the mucormycosis requires an antifungal called amphotericin B, which is extremely expensive, and also it is extremely toxic to the body to be given prophylactically. That is why this drug is reserved only for the treatment of those patients who acquire this infection. How do you prevent this infection? Let's watch it. So point number 1, avoid moist environment. Wear N95 or do double masking whenever you are going out. Number 2, do not self-medicate and use steroids injudicially without consulting doctors. Number 3, keep yourself sanitized and masks if you are currently on steroid medications, and practice doing steam inhalation and betadine gargles to clear your upper respiratory and gastrointestinal tract. Number 4, avoid coming in contact with soil, manure, waterlogged areas, and eating partially cooked plant meals. Number 5, use clean, sterile humidifiers during oxygen therapies. Number 6, use antibiotics and antifungals judicially. Number 7, monitor blood glucose levels post-COVID-19 discharge, especially in case of diabetics. And number 8, do not miss out on the signs and symptoms of mucormycosis. What are the signs and symptoms of black fungus? So you contact this black fungus spores through your nose, and via your nose it can go to your sinuses, so you can present with sinus pain, fever, one side swelling of the face. It can go into your orbit, present as an orbital swelling, go into your brain, produce headache, vomiting, and other symptoms. It can also go down to your lungs and present with chest pain, cough, and fever. It can also go down to your intestines, your GIT, and present with abdominal pain, bleeding from your GIT, vomiting, etc. The last sign and symptom to watch out for is if you have recently had any cut, especially plant-based, and if its edges began turning black, or if it presents with excessive swelling and inflammation, that is also one of the signs to watch out for. And lastly, I would like to end by putting a fact check, which is that black fungus is not contagious. That is, in case anybody around you has black fungus infection, please do not isolate them. Rush them to a hospital and begin with aggressive antifungal and surgical therapies. I would like to end by saying that black fungus has been recently declared as an epidemic amongst COVID-19 patients in India by the Forbes magazine on 20th May 2021. So you need to do your part, and you need to spread the right awareness amongst everybody suffering or non-sufferers of COVID-19 infection. So please like this video and share it with everybody around you, and subscribe for more health updates. Thank you.